You asked him if he could see your screen.
Richard, can you see the screen? Awesome. Good deal. So we're just waiting on a couple more people, and we'll go ahead and get this party started.
Could you start the recording?
I already did.
Oh, you did?
Mm-hmm.
Okay.
So how are you doing this morning, Richard? Great. We'll just give it a couple more minutes here. We're going to go ahead and get started here. Let me take a look and see who else confirmed. Patty. Oh, Nicole. All right, cool. All right, count down 1 minute. All right, let's go ahead and get started. So today we're going to go over Medicare.gov. Medicare.gov is an online website that was designed by the federal government for consumers. And actually, anyone can actually go on this site. It's particularly tailored for consumers and Medicare brokers to be able to go on here and get as much education information as possible as it relates to Medicare. This is the home screen here. Jim's going to cover what the home screen looks like. On this home screen, there's several things that you can do. If you notice these boxes right here at the very top, when you click on them, it'll give you an array of different options of things that you can kind of explore. Everything from getting started with Medicare, information on, what do people have to do to get their process going, how do they qualify for Parts A and B, if they have employer coverage, how does that affect them. They could also apply for Medicare online here, which is a very easy process. When can they join a health or drug plan? That goes, it's in relation to their enrollment periods, education on types of different Medicare health plans, and then also this icon down here. If you ever run into somebody who you're wondering whether or not they have LIS, and LIS is a low-income subsidy for prescription drugs, and or you just want to check, what their Medicare status is, you can actually click on here, and it's very simple. You type in the zip code, the Medicare number, their last name, date of birth, and their effective date for Part A. And once you put that information in here, click Continue, then it'll take you to a screen that will show you their Medicare status. If they're on the Medicare Advantage plan, it'll tell you what Medicare Advantage plan they are on. If they have any type of Medi-Cal eligibility, it'll tell you if they're full dual eligible. If they have LIS, it'll also show you if they have that low-income subsidy. Okay. Here you're going to find different information with regards to Part A and Part B. A lot of this stuff can come in really handy. A lot of this information you learn in your AHIP, but you can always access it here. And for me to be able to get to where I'm at now, this was very helpful because, for example, if you ever have somebody ask you, hey, you know what, I don't have any credits for Medicare, but can I purchase Medicare? The answer would be yes. And they say, well, how much would my Part A cost me if I don't have any credits? At that point, you can say, hey, well, let me look that up for you. You can look it up, and it'll tell you right here. Part A will cost them $437 a month if they have less than 30 quarters. If they may have some quarters, and they have between 31 and less than 40 quarters, then they would pay $240. So this is, information that becomes so valuable, and maybe you don't know it by heart, and you don't have to, but at the very least, you have to be able to know where to get that information in the event that you're asked. Because if you are asked and if you can give them the information, well, guess what? That builds trust between your client and yourself, and trust is the foundation of everything that we do. If they don't trust you, it's going to be hard for them to allow you to guide them as to what they should do. But the more information that you can share with them by answering their questions or helping them find those answers, then the more they're going to trust in you knowing what you are doing. Okay? So different parts of Medicare, you should already know that. What does Part A cover? This gives you information as to what it covers. Inpatient hospital care. Let's take a closer look in here. These are very important numbers here. So if somebody were to ask you, hey, well, all I have is Part A and Part B, but do I really need to get a supplemental? Do I really need to get a Medicare Advantage plan? And you say, well, you know what, that's a great question, but let's just say you were to be hospitalized. If you were hospitalized for the first 60 days, you're going to have a deductible that's $1,364. And, that's going to open their eyes. If you're in the hospital longer than 60 days, and from day 61 to day 90, it's a daily payment of $341 per day. And then above 91 days, then here you are, $682. So a lot of valuable information you can get on this website. Okay, let's look at Part B. What happens if you run into somebody who tells you, hey, you know what, Carlos, I'm really considering going on Medicare. Currently, I'm going to be turning 65 soon, but my employer covers my insurance, and I plan on working for at least another year. So my employer insurance right now is costing me just about $300 a month. But, my dad, he's on Medicare, and he's on one of these Medicare Advantage programs, and all that's required for him to do that is for him to have Part A and Part B. This Part B is about $135. So to me, that sounds pretty good because, the coverage looks pretty good, and it's just comparable to what I have at work, but it's a couple $100 less than what I pay at work. And then I would say something like, yes, that's actually correct. However, there's this rule called IRMA, and what IRMA dictates, or what IRMA stands for, is Income Related Monthly Adjustment Amount. What it says is that if your income is above a certain level, then you're going to pay more for Part B. So if your income is over $85,000 a year as an individual, or $170,000 a year as a couple filing jointly, they're going to charge you more for Part B. Client will say, wow, interesting. Okay, it's just, so how much would I pay? Well, what is your income? It says, well, between my wife and I, we're about $350,000 a year. Okay, that puts you right here in this bracket. Okay, that means that your Part B premium is going to be about $434 per month. Then this guy's going to say, wow, that's much more than the $135 I thought I was going to pay. And it's definitely more than what I'm paying for my employer insurance. I did not know that. I think I'm going to go ahead and continue with my employer plan as long as I can because, it looks like that Part B is going to cost me more than I thought it was going to cost me. So, again, become familiar with this site, explore it, because you can find a lot of valuable information on here. The way that I learned everything on here was just by exploring, going on here and clicking in every single one of these icons and seeing what's on here, what it's all about. Okay, this information here regarding prescription drug coverage as well. Same thing if you're dealing with somebody who has a high income and they want to know how that affects them, then, right here we can see that the prescription drug, even though they're on a Medicare Advantage plan with no premium, if their income is over that certain level, like I just mentioned, in this case it was in this bracket right here between just over $350,000 a year, then Part D, Medicare is going to add a premium adjustment. Even though the plan has no premium, they're going to receive a premium adjustment, which means they'll have a premium. In this case, it would be close to $71 per month. So when we fill out an application, there's a section where it asks you if you have a late enrollment penalty or if we determine that you have a Medicare premium adjustment because of IRMA, how would you like to pay that? Well, this is what they're referring to. Okay, again, if they have an income that's above this level, these are the adjustments. Okay, so become familiar with how to access this information because, eventually you're going to run into somebody who has that situation, and all the tools are on this site to be able to help you give them those answers. All right. Other things you can find here: forms, Medicare forms. There's all kinds of different forms they have in here. This is a really good form right here. I have Part A and want to apply for Part B. This form right here, let's say you run into somebody who delayed Part B enrollment because they have employer insurance, and now they're 68, 69 years old, ready to leave their employer insurance and go on to Medicare. So most people would tell them, go to the Social Security office, tell them you want to sign up for Medicare. They're going to go stand in line at Social Security for a couple of hours, finally going to see an agent, and then the agent's going to tell them, here are these two forms. One of them is going to be filled out by your employer, which is this form right here. The other one is going to be to apply for Part B, and that's this form right here. Okay. So actually, the first one is the application for Part B. The second one is the one that's the employer form. So these two forms are very important. I would advise you to click on this link and save them on your computer, or print some copies so you have them handy. So if you ever meet with an appointment with somebody who is going to be enrolling into Part B late, you have these forms. Because guess what happens if you help them avoid having to go into Social Security twice? They're really going to appreciate you. And again, part of our job and our role is to help make this transition easy for them. Okay. All right. So one of the primary, in fact, the primary tool that Medicare.gov provides is the ability to look up prescription medications and look and compare health plans. So the way you would do that is, let's say I have a client who is taking some medications and they're with the Riverside Medical Clinic. First thing I want to do is I want to be familiar with the plans that are with the Riverside Medical Clinic. I know that they contract with 8 different companies there. So long as I'm familiar with that information, I can go ahead and navigate through here and be able to find a good plan for them. So first thing we're going to do is click on Find Health and Drug Plans. I'm going to punch in the zip code where they live. It's very important that you don't just pick any zip code in their area. You want to narrow it down because what will happen is it's going to take us to a page that has pharmacies closest to them. All right, so we're going to click on Original Medicare. I always click on Original Medicare. And if they get extra help from Medicaid or LIS, then regardless of what plan they enroll into, that extra help is going to apply. Okay, but I always click on I don't get extra help. Would you like to add your drugs now? I'm going to say yes. Continue to plan results. All right, so this is a section where we're going to input our medications. We want to be very detailed about this, so we want to make sure that we are precise and accurate. Best practice is to take a look at the actual medication bottles because they may be taking a generic. Sometimes they think it's a brand name, and if you quote them a price given on a brand name, then they may say, you know what, no, that's way more than what I pay now. And again, best practice is take a look at the bottles. So I'm going to put in a couple of medications in here that are commonly used medications. There's a blood pressure medication, lovastatin. It will always take you to the most commonly prescribed medication. Okay, and this medication is usually prescribed, has a 30-day supply. So if you see 30 here, that means that this medication is taken once a day. If you look at the bottle and the medication says twice a day, then you're going to want to click 60 on here. Okay. The reason why I want to be accurate here is because even though the copay is going to be the same for 60 pills or 30 days, 60 pills or 30 pills for a 30-day supply, the cost of the drug to the insurance is going to be different. Obviously, the more pills that are dispensed, the greater the cost. Okay. So I always leave it here at default every month, and I get it from retail pharmacy. All right, so now we're going to add another medication here. Let's go ahead and add some insulin. Let's see, let's go with Lantus. Okay, so notice there's two Lantus here. So we'll start with a pen, which makes it very convenient for them to inject. In regular Lantus is a vial. It's an actual syringe type of injection. So the SoloStar is always going to be more expensive. If they're willing to pay a higher price for the SoloStar, just keep in mind that the greater the cost, the greater the chance that they may go into the donut hole or the gap. Okay, so this only comes with one variation. Again, it comes with one package. It's a 10 milliliter vial. Okay, it's 1 month supply. All right, so let's add another medication here. So I'm going to add a high-cost medication called Victoza. All right, so once again, comes in a package sold of 3 or a package sold of 2. It's always going to take you to the most commonly used. All right, so we got some medications on here. If you look here, it'll tell us generics available for Lantus. Lovastatin is generic. Victoza not available in the generic. Okay, so right here, the second, we're going to want to write down this information down on a piece of paper, some paper that's going to be attached to their file or to your records. You can put this maybe on the back side of the application. Anywhere that's going to match in your files along with the profile. So we got a drug list ID and a password date. These are very important because if you ever have to go back in here and pull up the drug list, you're going to need this information here. And the reason why that is important because let's just say that these are the medications that they had you look up and you quote them on these prices, and several months down the road they call you back and they tell you, listen, I just went to the pharmacy and they're charging me an arm and a leg for this drug, and I'm pretty upset because you didn't tell me this was going to be the cost of this drug. And once you get to a point where you deal with so many people, you're not going to remember, like, oh, dang, what drugs did I look up from? So this will be able to help you pull up this drug list, number one, so you can identify what medications you looked up for your client. And if you can confirm that the medication he's giving you is not on this list, well, hey, you have proof. That's happened to me before, where I say, Mr. Jones, I just looked up your medication list, and that medication that you just gave me is not on the list of the drugs that we looked up. Is this a drug that you just started recently taking, or what's going on here? And Mr. Jones, guess what he said? You know what? Yeah, actually, it just got prescribed. Oh, okay, so this wasn't the medication I looked up for you prior, correct? Yes. Okay. That changes everything. So this is here to protect you, okay, from any type of allegation because this provides proof of the medications that you looked up. All right, so we're going to click on my drug list is complete. And this is where the zip code search is also very important because now it's going to pull up the pharmacies closest to their zip code. Okay, so best practice, always pick a CVS and in either a Rite Aid or a Walgreens. if you don't know by now, there are some plans that have preferred pharmacies versus just regular select pharmacies, or standard pharmacies, I should say. They will always get a better copay at the preferred pharmacy than at the standard pharmacy. So, well, one way that you can find out, depending on the health plan, as to whether the pharmacy is preferred or a select pharmacy, standard pharmacy, is by checking out the plans. Okay, so on this page here, we have different options. Okay, we have prescription drug plans only. This is for people who want a Medicare supplement plan. So let's take a look and see what this shows us here. We click on here. It's going to take us to a page where it's going to show you different Part D plans. This is Part D only. Okay, it's going to give you an estimated drug cost contingent upon when you're doing the search. So this is the estimated drug cost for the remainder of the year. This is the monthly premium. Okay. See, there's variation in premium and cost. All right. This gives you the star ratings also. 2 out of 5 stars. Wow, not that great, huh? Sometimes they have a low star rating because of the fact that they're very new to the market. Okay, so first thing you do when you get on this page, you click on View All. So this way it gives you the entire list of prescription drug plans. Otherwise, it's just going to give you a handful, and you want to be able to make sure that you can kind of look at all their options. There's a ton of them here. This Aetna Medicare RX Select plan seems to be pretty good. If you notice, the premium's only just over $19 per month. I would say people tend to be pretty happy with this this prescription drug plan. But there are several options here as well too. So you definitely want to have at least 3 or 4 prescription drug plans available to you. And my go-tos are usually Aetna, Blue Shield, Humana, and Anthem. Okay. Again, that drug list ID is here. It's going to continue to populate, and the password date also very important. So if we were to click on one of these plans, let's go down to that Aetna. Okay, so only $19 per month. We're going to click on here, drug costs and drug coverage. So CVS is the preferred pharmacy with Aetna. Okay, first thing we're going to see is that this Lantus is actually not covered. All right. So if it's not covered, let's scroll down and see what they got. Not on formulary. Okay. This means that they're going to have to submit authorization for this medication in order for it to be covered. The lovastatin has a 0 copay, and looks like the Victoza is also not covered, which also means that they're going to have to submit authorization to get this drug covered. Okay. Now, you notice that the Aetna premium is very low, right? Well, the result of it being very low is that these high-cost medications are not going to be covered. So let's go back to our plan results. Let's click on a plan that has a higher premium. Okay, so let's see here. Let's take a look at this Humana Enhanced plan. Okay, so our premium just quadrupled. Okay, it went from about $20 to $80 per month. But let's see what happens when we click on here. First thing is that the annual deductible for medications is eliminated. Okay. Okay, this uses all pharmacies, standard pharmacies. So the Lantus is covered on this plan at a $47 copay. The lovastatin has a $5 copay, and the Victoza is also covered at a $47 copay. So you can see the difference. By paying more per month, they're going to eliminate the headache of having to have that medication authorized. And usually when medications get authorized on a plan that does not have them for it, They usually, if it's a brand name drug, they usually get authorized as a Tier 4. And Tier 4s are usually around $100 copay. So whatever they thought they were going to save in that plan that's $19 per month, they're going to end up paying back in, number one, the stress of having to get things authorized because the drug is not covered. So let's go back to refine your plan results. Okay, so now we're going to click on Medicare health plans with drug coverage. Shows 38 different plans. These are your Medicare Advantage programs, MAPDs, Medicare Advantage Plus prescription drug coverage. Okay, first thing we're going to click on View All. All right. So, Riverside Medical Clinic. The top selling plan there has been Central Health Plan. So let's look at what this plan can do for them. So first thing we're going to do is go to drug cost and coverage. Okay, that Atlantis, big difference. They're covering that Atlantis at a $10 copay. That's because Central Health Plan has actually 6 tiers available to their patient. Most plans only have tiers 1 through 5, tier 1 being preferred generic, tier 2 being standard generic, tier 3 being preferred brand, tier 4 being non-preferred drugs, tier 5 being specialty drugs. And usually that's it. This plan has a tier 6. And on the tier 6 is a select tier where they can find certain medications at a very affordable copay. So that Atlantis is going to cost them $10 for a 30-day supply. The Lovastatin is $0 copay. And the Victoza is a $35 copay, very affordable. This is a lot better than them having to get these authorized in a plan that does not have them in the formulary and then authorizes them at a $100 copay or so for a 30-day supply. Now, when we scroll down here, we're going to notice we have this calendar, okay, January to December. So month to month is going to show us their total out-of-pocket cost for the drug, and if they're in the green, then that means that they're in their initial coverage stage, okay. If they go into the red, that means that they have exceeded their allowance. Now, one way you can kind of forecast how that can happen is if we take a look at the screen right here, it's going to show us the actual full cost of the drug. If we look at this Lantus is around $276 for a 30-day supply. Even though their copay is only $10, the entire $276 is going to come off their $3,820 initial coverage limit. The Lovastatin is no big deal. It's only about $3. The Victoza, look at the Victoza. The Victoza has a standard retail cost of just under $900 for a 30-day supply. When we add up the entire totals, we're looking at $1,175 every month that's going to come off of their allowance. So it's going to take them just over 3 months to exhaust their allowance. What happens now is that they go into the donut hole or the gap. That's why they're in the red here. Now, one of the things to consider also is that when they're in the donut hole or the gap, even though they're paying 25% of the cost of the drug, which would be these numbers here, 25% of Lantus would be just under $70. 25% of the Victoza would be just about $225 per month. Even though they're only paying this much, 25% of the cost of the drugs, not only does the 25% that they're paying out of pocket count towards their catastrophic limit, but the discount that the insurance is paying on their behalf also counts towards their catastrophic limit. And it actually helps them go through that gap faster. Okay. Now, this is always only going to show information based upon what time of the year we are in. But if we were doing this analysis, like let's say for the following year during the Medicare annual enrollment period, this would show us a complete calendar, and it'll tell us when they would be going into the gap. Okay. So very important that you become familiar with this. If they do hit the $5,100 catastrophic limit, then at that point forward, from that point forward, they're going to pay a very, very low copay for their medications. Now, usually for medications that are between tiers 1 through 3, you will be paying between $3.40 and less than $9 medication per 30-day supply. But on the high-cost medications, they're going to be paying 5% of the cost of the drug. That 5% is what this is right here. Okay. Now, Central Health Plan uses all standard pharmacies, so cost is going to be virtually the same depending on what pharmacy they go. Okay. For whatever reason, you've done this search and all of a sudden say, oh, you know what, I forgot to add one of the medications that I'm taking. You can always go down here and add medications. Okay. Very easy. Okay. Now, I'm going to show you something else. Let's say you have an individual that says, oh, you know what, I'm really considering Kaiser. And so do you sell Kaiser? I don't sell Kaiser. Kaiser does not have any outside representation. But I can show you Kaiser right here on Medicare.gov. So let's go ahead and scroll down to Kaiser, all the way towards the bottom. Here they are. We're going to click on them. We're going to compare them with Central Health Plan. Okay, so health plan benefits. Oh, wait a minute, I chose the wrong Central Health Plan. Hang on. Let's do this again. Boom. Okay, now we're going to do the comparison. So we're going to have a side-by-side comparison between Kaiser and Central Health Plan. Okay, neither plan has a monthly premium, neither plan has a deductible. Both each and most. Kaiser has a higher maximum out of pocket at $4,900, where Central Health Plan is only $3,400. They're going to say, oh, okay. Inpatient hospitalization, Kaiser's $285 per day for the first 7 days. Central Health Plan is zero copay. They're like, oh, whoa, okay, that's a big difference. Outpatient surgery, Kaiser's going to be $250 per visit. With Central Health Plan, there's no copay. Doctor visits, Kaiser's going to be $30 per primary, $32 for specialist. Central Health Plan, zero copay either or, primary or specialist. But at this point, they're already going to be like, oh, damn. Why is this Kaiser so much more expensive? And here you can do a thorough comparison for them. And you'll see that, wow, do I really, really want Kaiser? Okay. So, again, it's a matter of becoming familiar on how to do this comparison and how to present these benefits. Okay? Let's take a look at the drug cost and coverage. Okay, so this is showing us some really whack numbers with Kaiser because obviously it's not showing us the Kaiser pharmacy. So first thing we would have to do here is also select a Kaiser pharmacy. So let's go back here. We're going to eliminate Walgreens. We're going to expand our distance. Oh, it's not coming up. We have to expand it even further. So again, we're looking for that Kaiser Pharmacy. There it is, at pharmacy. We got two pharmacies on Kaiser and CVS. It gives a better idea, so we can give them a thorough comparison. And first thing, view all. I'm going to click on Central Health Plan. We're going to scroll all the way down. Oh, where did Kaiser go? There it is. All right. Drug costs and drug coverage. So, if they get their medications at Kaiser, we're looking at, this is for the rest of the year, about $816 out-of-pocket costs. With the Central Health Plan, we're looking at about half of that, about $381. Big difference, because that's contingent upon the last trimester of the year. We multiply these numbers times 3. We're looking at $2,400, $2,500 out of pocket with Kaiser, where we're looking at just under $1,200 with Central Health Plan. So, big difference with a lot of these plans. Okay. All right. So, let's go back to your plan results. So let's just say that they realize, okay, well, Kaiser's not an option. What else do we have? Well, for example, the Riverside Medical Clinic or San Bernardino Medical Clinic, they do have several good options. Central Health Plan is one, and another good option would be a plan as Alignment Health Plan. So let's take a look at Alignment Health Plan, the Platinum Plan. These are going to be very close. Let's look at the drug costs here. Okay, I still have the Kaiser Pharmacy here, so just disregard that. But so you can see that Central Health Plan still has a better total out-of-pocket cost than even Alignment Health Plan. Okay. All right. So let's take a look at this Golden State Plan. This Golden State Plan has a very small network, but if they're taking high-cost medications, they may say, hey, you know what? Well, I'm willing to change my doctor. I mean, these medications, I have to take them no matter what. You know, it's life or death. So is there any plan out there that will kind of give me a better deal on these medications? Well, let's take a look at Golden State Health Plan. $10, okay, for the medications, the Lantus and the Victoza. And if they go to the gap, which they will, they go down from 10 to 3. That is freaking unbelievable. This is insane for these high-cost medications. Look at this Victoza. It's almost $1,000. And if they go into the gap, 25% of $1,000 would be $250. And they're covering it at a $3 copay. And that is just amazing. But the problem is they probably have to switch their primary doctor to a doctor such as plan. So if sometimes push comes to shove, and it's a matter of finances, and this is all they can do, then this would be a great solution for them. Okay. All right, let me check something here. Okay, so Richard, do you have any questions? Okay, good. And let me see, is Patty, are you still on here? And I think Patty may have logged on. Yeah, so just become familiar with this site, Richard, because this is a very, very instrumental. It's going to help you a ton when it comes to being able to assist your clients and review. Make sure that when you look up medications, you always get this drug list ID number here and the password date. These are very important because these are going to, in essence, allow you to log back in here and look up this information anytime. So that way, if there's ever a client that tells you, hey, you know what, that's not what you quoted me, you can always go back and pull this information out and be like, look, this is exactly what I quoted you. Okay? So, if you don't have any further questions, then that, okay, let me see, can you click from the beginning to drug list thing, if you will? Okay. All right, so let's start from the beginning. Okay. All right, so again, in review, Medicare.gov, this is where we start. Okay? And then you're going to go to Find Health and Drug Plans. We're going to type in the zip code. We'll go with 92504 this time. Okay. We're going to click on Original Medicare. I don't get extra help. Would you like to add your drugs now? Say yes. And this is where you add your medications. Let's add a different one this time. Omeprazole. Okay. Make sure that we are accurate because if we're going to be accurate with the dosage, quantity, once a month. Let's go with let's see here, atorvastatin. Atorvastatin is a generic for Lipitor. Okay, it's a tablet, most commonly used with 10 milligram. Okay, and let's add another expensive medication here, Crestor. Okay, most commonly used one is 10 milligram, 30-day supply, 30 pills. Notice that I typed in Crestor and it's telling me, hey, are you sure you don't want to use rosuvastatin? Rosuvastatin is the generic for Crestor. Okay, so again, that's why it's always important to take a look at the bottles. In this case, if they are taking Crestor, which will just an example of what we are, so give us a drug list ID, password date, and let's click on Rite Aid and CVS. Okay, we're going to go to continue to plan results. Medicare health plans with drug coverage. And view all. Okay, so estimated drug cost with Anthem is $188. Aetna's about $400. Okay, Inter Valley. Wow, that's a desert preferred choice, but still Central. So let's click on Central real quick. So the Central Health Plan looks like they don't cover Crestor. Okay. The atorvastatin is zero copay, the omeprazole zero copay, but the Crestor is going to have to get authorized. If it's authorized, you're going to cover it as a tier 4, which would be a $75 copay. Okay. So I noticed that Anthem had it actually for a lesser amount. So let's take a look and see what Anthem MediBlue Select, how they cover it. Because I know that Anthem MediBlue Select is another plan at the Riverside Medical Clinic. So let's take a look and see what they do for us. They're covering Crestor at a $47 copay, which is less than the $75 that Central Health Plan would have to get it authorized for. Well, likely this drug is still going to have to get authorized, but it is in their formulary, so it's going to be easier to get authorized. Where with the Central Health Plan, the client may have to request a formulary exception so they cover the drug. It looks like they'd be in the green for the rest of the year. That Crestor is around $270 per 30-day supply. Let's go back to our plan results and let's see who else is that. Okay, let's take a look at Alignment Health Plan. Another Alignment Health Plan is another plan that's at the Riverside Medical Clinic. Alignment Health Plan does not cover Crestor. Okay. Let's check out who else we got here. Inter Valley Health Plan. Let's see what they do for us. Inter Valley Health Plan. We are looking at. They don't cover it either. Okay. So again, that's going to gives us a little bit of issues getting it authorized. Let's take a look at United Healthcare. Even though they have a $18 monthly premium, we figure, okay, I'm going to pay more for my plan, but does that mean that I'm going to get better coverage for my prescription drugs? Well, let's see. Let's see how they cover that Crestor. They don't cover it either. Not on formulary. More than likely, they're going to want the client to take that rosuvastatin. And if you want a client that doesn't want to have to hassle with authorizations, then depending on who their providers are and what plans they contract with, in this case, if we're with Riverside Clinic, then this Anthem plan is going to work great. Let's take a look at Kaiser just for, let's see what they got going on. Oh, that's right. I gotta change the pharmacy here. Shit. Let's see what kind of coverage Kaiser provides for this Crestor. And it looks like they are covering it, but they're covering it as a Tier 4 non-preferred drug, but they are covering it. But it's still $100 for a 30-day supply. So again, in this situation, it looks like Anthem would be a better choice for them if they're with the Riverside Medical Clinic. This plan is also accepted, I believe, by Regal Medical Group. And I believe Prime Care of Riverside also takes this plan. Okay, let's see here. Yep, $42. Let's see this. So actually, CVS is a preferred pharmacy. Well, earlier we had a Rite Aid up here, and with Rite Aid it was $47, and that's because Rite Aid is a not preferred pharmacy. $42 is definitely better than that $100 that Kaiser has. That. All right. And yes, Richard, write the drug list ID number in your records, and the records that are attached to the application. You can actually, whenever you submit an application, you're supposed to submit it with a cover sheet. And on that cover sheet, on the lower right-hand corner, there's a section where you can add drug information. You can write the drug list ID number on there. And if you like to keep files, copies of your application, then that's definitely the place where you want to write it. Again, it's not just the drug list ID number, but it's also password date. Both of those are very important because you won't be able to proceed without having both of those, and it will not allow you to pull up that drug list ID unless you have them both. Okay. Do you have any further questions, Richard? Okay, great. Well, that concludes this Medicare 101 training. Thanks for stopping by. If you have any further questions, you have my number. Reach out to me. Again, I would spend some time and navigate through the website. You're going to be using the website for primarily looking up medications, but you can also look it up for a lot of other things. Use it for a lot of other things as well too. All right. So thanks again for stopping by, and this concludes the Medicare.gov presentation. Have a wonderful day.